Hey folks, Chad Duplantis with Dentist in the Know, and I had the joy and privilege of meeting this gentleman. It was pre-COVID,
Yeah,
about 5, 6 years ago. So I'm with Dr. Fred Peck, practices in Cincinnati, Ohio. Is
yep,
that
that's
correct?
correct.
So Fred, tell us a little bit about you, your practice, and what what moves you in dentistry.
So, been in practice about 38 years.
Okay.
Practice was started by my grandfather,
Really?
1931.
Okay.
Yeah.
Same building?
Not quite. Not quite. And then my dad went into practice. He and I practiced for 14 years before he passed away, and I've been at it by myself ever since.
Okay.
So, having a great time. It's fun to see 3 and 4 generations of patients too. You
Well,
know? So that's it just makes it fun.
You know, it's funny. We were just talking about that a minute ago. I had Paul Feuerstein in here, and he was telling me about seeing the generations of patients. I've been at it 25 years, and I'm doing the same thing. Now, I know you have children. Nobody's going to be a dentist.
No, both went the engineering route.
Okay, okay.
Yeah.
So, is that was that a little hard?
The older one I knew would have nothing to do with it.
Yeah.
The younger one, it was like maybe, and then like the first week of college, he says, "Dad, I'm not going to the pre-dent meeting. I think I'm going to do engineering." I'm like, you know something, that's where you belong.
Hey,
And he's happy.
that's the thing. I mean, I think, we talk about all things dentistry and whatnot, but I think that as a father, yes, I would love to have one of my children take over my practice, but I'm certainly not going to pigeonhole them into that or make them feel like that's what they have to do. I want them to find their passion. And I think we just got to be supportive. That's all
Right.
we can do.
Right. So he still helps me with the tech support,
There you
behind
go.
the scenes.
Yeah, yeah.
So
So-
that's okay.
what's the plan? Do you have an exit strategy?
So new associate started with me 1st of May.
Okay.
She's working out quite well. So I'm not ready to retire. I'm having
No.
too much fun doing what I'm doing.
I know. I know.
It's just fun. And so trying to build her practice up, and that's the plan.
Do you have any patients in your practice that did still see your grandfather?
Oh, yeah.
Really?
Yeah, they're in there. He passed away in 1976.
Oh my
So these
gosh.
patients in their 80s and 90s.
Oh my gosh.
And there's a few patients in their late 60s, 70s that saw my grandfather when they were little kids.
Oh my gosh, that's
So,
really cool.
yeah.
That's really cool.
Yeah.
That to me just brings so much joy. I went in to see a family last week, and I saw this kid, and I walk in and I expect him to, still be the 5 or 6 year old
I know.
that started coming to the practice, and his feet are hanging off one end of the chair, his head's off the other
Right.
end of the chair, and that's what kind of drives me. So my next question for you is I know that you speak, I know that you lecture. What moves you in dentistry? What is your passion?
So passion is anterior cosmetics.
Okay.
Just really helping a patient get more confident
Okay.
with their smile. And then part of that is, as we all know when we first start out, some of those things we did early on don't quite last.
Yeah.
And,
Yeah.
it's nice to know now, I'll say 99%, because we still do stupid things every once in a while, like, yeah, I can fix that, and you really can't, that I know it's going to last.
Yeah.
And that's what's important. And it was interesting because I had a patient that was my dad and grandfather's, and I did some work on her, like, I was a year or two into practice, didn't know what I was doing, hadn't done much occlusion, and didn't last. She went elsewhere. Well, it didn't last from anybody, and I had the opportunity to redo it just last year, and now I know what the problems were and got it done, fixed it the right way.
That brings up a whole new topic, and to me that brings up a topic of trust. It's not necessarily, she's like, oh, Dr. Peck's got a few more years of experience under his belt, I'm going to go back there. It's a trust, it's a loyalty thing, and that's when
Right.
they came back, and now you're like, okay, I do have a few more years under
Yeah.
my belt. I know what broke.
I
I
know
know how it broke, why it broke.
Exactly.
We're going to fix it.
And I've been seeing her daughter all along.
Yeah.
So now I got it fixed, and at 92, she's smiling and happy as can be, and I'm happy.
That's awesome. What organizations are you involved in dentistry?
So, very active in the American Academy of Cosmetic Dentistry.
Okay.
Phenomenal group of people.
Okay.
Kind of really got me going down this cosmetic road.
Now that you say that, I've got to ask because I was hoping you would answer that way. But there's a lot of young dentists that I see that are out there that really don't know about the American Academy of Cosmetic Dentistry. Tell us why a dentist should look into, should join, and possibly should become accredited in the American Academy of Cosmetic Dentistry.
The organization really wants to teach, as that is our purpose is knowledge and giving that knowledge to our members. We've got courses, hands-on courses, one of the few where we have so many hands-on courses at the meeting. Dentists can come and really get a good feel of a variety of cosmetic techniques. It's not just doing a crown on a front tooth. Direct resin is very important, and I get a lot of referrals for my direct resin techniques.
Really?
Yeah, I mean, a lot of the pediatric dentists and a lot of the orthodontists. Peck laterals and chip teeth, and they're like, no, go to Peck.
Yeah.
So the accreditation process is a phenomenal process. I was taught by Dr. Paul Landman, who was a past president, when I was debating to go through the process, he goes, it's not the piece of paper you're going to get on the end. He goes, it's the journey you're going to go through to get that accreditation. And that journey started in the late 90s and still continues. I mean, yes, I'm an accredited fellow now, but the journey continues, and it's fun. And dentists that don't join, I was talking to a young dentist, she's not so young, but a dentist yesterday at the American Equilibration meeting, and she's like, I've been meaning to join. I go, what's holding you back? She pulled out her phone right then and there and joined.
That's it.
I said, she has an accredited lab tech working in her practice. What are you waiting for?
Yeah. And I think that one of the things that I see outside of that is the friendships that you all make. It's funny to say this, but if we're out in a crowd of people and then you see the AACD, I think there's people that's their bond, and it just relays through life. I mean, I say this because one of my neighbors, a member at our church, is a guy that you probably know named Greg Wright.
Sure.
And
President right now.
It's funny. Everybody knows Greg Wright, And Greg, I don't know how he is at AECD, but when I'm around him, he's such a quiet guy.
He is just, yes,
but
absolutely.
I watch, he's such an amazing dentist, and I watch all these people. I can throw Greg's name out, and everybody knows Greg. Everybody loves the dentistry that Greg does. And I see that about anybody that I could ask Greg your name, and he's going to say the same things. There's a lot of bonds that have been made through AACD. That's important too, but the phrase you said earlier, I just want to bottle that up because I think we could say that for a lot of things. When we're going through something grueling, sometimes even in college, it's not the piece of paper you get at the end, it's the process.
Exactly.
I have so many fond memories of college, of dental school, all good, it's just, that could be said about a lot of things in life, Now, you teach as well.
Yep.
Okay, what and where are you teaching coming up, or where can people find you and see you?
So, right now, I've just got some local lectures. I was at Greater New York this past year, and Ohio Dental Association, and that'll be coming up again. We just haven't figured the dates yet.
Okay.
I do a lot of stuff with Clinician's Choice,
okay,
which makes some great products and great company to work with. I was in Jamaica last year, and Texas, the TDA, and so we'll see what transpires. But there's always things coming on the horizon.
Always something coming on the horizon. Well, you made a great comment. Clinician's Choice, that's where I first met Fred. We were in Aruba. I got to see Fred lecture. It's something that you won't want to miss. So I encourage everybody to see Fred, learn more about Fred. But I just appreciate you all watching the show, and I appreciate Fred being here. Thanks.
Yeah, thanks a lot.
All right.
Appreciate it.